Hey guys, this is Dr. Morse reporting in. A new injury just popped up on the wire saying that Dodgers relief pitcher Kenley Jansen is dealing with what we call an irregular heartbeat. So I wanted to cover this real quick because you probably won't get much of an explanation anywhere else. So I'm going to look at the info real quick. So it sounds like he was taken to a local hospital in Denver late last night before flying home. We know he's dealt with multiple issues with his heart in the past. So what does this mean? Usually the heart beats in a cyclical pattern with some electrodes, and it has an electrical conduction pattern. Well, what that translates to is a normal heartbeat. Well, every once in a while, some people can have an abnormal extra heartbeat. So one player that comes to mind is the Spurs player who I think it was Aldridge. I think it was Aldridge who had it, and it's called WPW, or Wolff-Parkinson-White syndrome. There's a couple other issues that people can also have that are similar to this. What happens is you get these random bouts of really high. You feel super anxious, nervous. You feel like your heart is going to pound out of your chest. And what happens is the heart has an extra beat, and instead of this normal heart pattern, it adds a second one which overrides the first one. So instead of going 60 beats per minute, it ends up going like 160. So it's like driving your car, and then all of a sudden out of nowhere you unexpectedly slam on the gas and go 90 when you're supposed to go 30. That's kind of what's happening in the heart, and it's really scary, and it makes you feel like you're dying. So the issue with these is that they undergo what they call ablation. So you can take meds, but meds aren't the best for these. So usually what they do is they'll go into the heart here. They'll use a little cautery or electrical stem, and they will try to burn out where the extra source is coming from. So that's my thoughts. It remains to be seen how long he's going to be out, because this is obviously scary. And it really throws off the comfort and the level of that pitcher or that player, because they don't know when their heart's going to be normal again, or when this is going to happen again. So when we hear more information, I'll give you more, but that's what I have for the Dodgers. Kenley Jansen, their closer, which as we start ramping up for the playoffs over the next 6 to 8 weeks, if he's out, that is a big deal. You're not really going to replicate him or replace him. So that will change, could potentially change things. So that's what I have for this topic. Feel free to subscribe or hit me on Twitter at Dr. Jesse Morse for more information. Thanks. Talk to you soon.